you look at risk factors for developing dementias in general, a history of depression is a risk factor. And the reason for this is because, as we've talked about in earlier classes, you can have toxic levels of cortisol with major depressions, and that selectively damages a couple parts of the brain, and one part of the brain is the hippocampus. And so if you look at people who have a history of depression, they have higher rates of dementias across the board. So that makes it even more complex. Now, another issue is that you can have people that start to have some cognitive impairment, and they're starting to make mistakes. They're starting to fail at things that they do occupationally or having problems socially, and then you start having depression as a reaction to the person realizing they're not functioning very well. So that clouds the picture as well. So if you want to look at, is there a clear line that differentiates depression and dementia? The answer is no. There's a tremendous amount of overlap, okay? But here's the bottom line, and that is if you've got somebody who's got dementia, and this could be Alzheimer's disease, it can be vascular dementia, it could be Parkinson's disease, or what have you, is treating depression can make a huge difference, okay? Now, let's take a look at this. Very commonly, when you have somebody who has dementia, especially if you're looking at mid-stage dementia, like let's use Alzheimer's as probably the most common example. By mid-stage, people have lost a lot of language skills and especially their ability to introspect and self-observation. So we're having to base some of our diagnostic stuff on behaviors more than a person's ability to articulate that I'm feeling worthless. What you see with depression a lot of times is and this will come on the scene within weeks, is a decrease in activities of daily living. How do you know that this person with Alzheimer's disease is depressed? Alzheimer's disease, there's deterioration that occurs in a very, very gradual kind of way, almost imperceptible for a while. And if people get Alzheimer's disease and don't die from something else, they can live 12 to 15 years before they actually die from the Alzheimer's disease itself. So if you have somebody that's very slowly showing cognitive impairment, and then you start to see a real, if you see an abrupt change in mental status, that's probably stroke, okay, because that comes on immediately. But if you see that within a few weeks, they no longer can bathe themselves, they can't feed themselves, they can't get dressed, okay, probably the number one thing to think about is depression, okay? And even if they can't articulate how they feel, feel sad or pessimistic or anything like that, treating with antidepressants, when the antidepressants work, oftentimes then restores them to their previous level of activities of daily living. Now, when you do this, it helps the patient, but it really, really helps the caregiver. Half of people that are caregivers for a spouse, generally it's a spouse, who has a dementia, will go on to develop major depression. Somewhere between a third and a half, but up to 50%, and it's because it's a nightmare, to care for these people who have this debilitating degenerative nervous system diseases. It's not uncommon that caregivers are spending 100 hours a week directly doing something, controlling their behavior, bathing them, getting them dressed, waking up in the night because they're wandering and that kind of stuff. And so if somebody has really lost their ability for self-care over the last 3 weeks or so, if you treat the depression and they get restored, this is a gift really to the caregiver who has all of a sudden had a nightmare get even worse. And Alzheimer caregivers are frequently chosen for these studies on stress in general because it's considered to be one of the most severe chronic stresses. And with people living longer, we're just going to have a lot higher percentage of people that live long enough to get demented. Isn't that a happy thing to think about? Okay. Diagnostic problems in later stage dementia. In addition to loss of daily activities of daily life, you can start to see aggression or agitation. Now, in nursing homes, and again, I know I'm making a generalization, but I think that this is largely true. If you start to see rapid emergence of aggression or agitation, the first thing you want to look for is, are they developing a delirium on top of their dementia? So the person, let me give you a couple of examples. A woman's living in a nursing home, and she has Alzheimer's, and she's mid-stage Alzheimer's. She still has some language skills, but her self-help abilities are not great, and then she slips, you know, and falls down, but then gets back up, and then a few hours later starts getting abusive and yelling and aggressive. It may be that what's happened is she has a fracture. She's fractured a bone, and yet she can't articulate to people that she's experiencing pain, for instance. And in that case, you know, you would want to treat the fracture, obviously, and treat the pain. But what happens a lot of times is, what do? Go give her a bunch of Haldol. You know, knock her out, calm her down. Another thing with Alzheimer's disease, mid-stage Alzheimer's disease, is people can get dehydrated. With Alzheimer's, you lose the capacity to really detect when you're thirsty. And so a person can develop a delirium on top of the dementia because they're dehydrated. You can have infections. People can develop pneumonia. Sometimes you can have in older people pneumonia without running a fever. So the first thing you do is you look for medical causation, because you sure don't want to overlook that, but you don't want to just jump in and sock them with heavy-duty antipsychotics and just to shut them up when there's really another cause that needs to be dealt with. But those kind of things would come on within hours or days. Okay, so delirium can develop more rapidly, but over a period of several weeks, it very well may be that they're depressed. And instead of loading them up with antipsychotics, treating them with antidepressants may make a lot more sense. Significant weight loss, and you can see the rest here: tearfulness, screaming, and somatic delusions. Okay, all markers that depression may be a part of what's going on.